Hi, I'm Dr. Prashanth Kesari, Senior Cosmetic, Plastic Reconstructive and Microvascular Surgeon practicing out of Nypunya Plastic Surgery Team, Bangalore, India. How do we prepare for facial palsy reconstruction? If we are borrowing the nerve from nerve of masseter or cross-facial neurotization, then we do what is called pre-education, because when you chew, that chewing signals from the brain should make you use the facial expression muscles. So we have to do some amount of pre-education. If we are using a temporalis transfer, so we need to train you to express the expression from the face when you do movements like chewing and strong bite. Okay, so this pre-education is very important. Apart from that, we get the nerve evaluated by nerve conduction study, ENMG. These are the tests. And if we are doing any grafts like facial graft, we evaluate that area, donor area, and then we evaluate if we are taking gracilis muscle for functional muscle transfer, we evaluate that by doing scans and Doppler of that area. All this are done, and your fitness for surgery, anaesthesia fitness, all that is evaluated well beforehand the facial palsy surgery. Facial palsy surgeries are basically divided into nerve surgeries, muscle surgeries, and other static procedures. So, nerve procedures and muscle procedures are known as dynamic procedure, meaning it will give back the full range of activity of the facial muscles. As we know that facial nerve is damaged and its branches are available, we can connect them to some other electrical signal source or some other nerve, like we normally connect it to nerve to masseter or any other nerve that is available on the opposite side using a technique called cross facial nerve, and we put one graft called sural nerve graft to take the nerve supply from the opposite side of the face to this side. And apart from that, when we do functional muscle transfer, we take a small muscle called gracilis from the thigh and connects it blood vessels to the neck blood vessels and connect the nerve to again a nerve to masseter and connect it to the remaining facial muscles so that it acts like a replacement to them. Apart from that, we have static procedures, like if the eyelid is not closing, we put what are called weighted gold cartilage on the upper lid. So because of the weight, eye is closed and not open. We also do what is called torsorrhaphy, and then we take the angle of the mouth to the side like a facelift approach and raise the corner of the mouth and prevent the dribbling of saliva, food, and that reduces accumulation of food in the cheek area also. So there are the basic surgical procedures that are there to treat facial palsy, and they are extremely effective and very satisfying.